Awesome. Welcome to today's webinar. This webinar is going to focus on preparing for natural childbirth and just thinking about that journey that you take together, moving through your pregnancy, getting excited about it, learning all the different ways that you can explore potentially how you want to give birth, who's going to be there to support you, the classes that you take, the techniques that you might utilize, and how you want to prepare your body, both emotionally and physically, for that journey. So welcome. We are here for High Country Doulas Preparing for Natural Childbirth webinar, and my name is Allison Rollans. Oops. Let me scoot there. My name is Allison Rollans, and I am one of the owners of High Country Doulas. I've been douling for many years and really love helping families to prepare and feel confident and less anxious through that whole entire journey of pregnancy, labor and birth, and postpartum. Right. So let's talk about what does it mean to have a natural childbirth. A lot of women that I talk to and birthing persons really love to consider all of their options when it comes to their birth, their labor, and their birth. And there's so many different experiences, both for women who have one child or two child or three or however many kids you want to have. You will know that those experiences can be different. Sometimes it's because that baby may be in a different position. Maybe your baby is breech. Maybe your baby is larger or smaller. You have that baby early or late. So there's lots of different scenarios that go in. And I think the biggest thing is really understanding what actually happens during the process of labor and birth. Understanding that can make you feel more confident moving forward. But when you're talking about having an unmedicated or a natural childbirth, really the sensations of being fully present, working with your body and through your emotional aspects of your body and your physical aspects of your body, to feel more in control of your body is really what a lot of women want, to be able to feel like they have choices and options. And oftentimes an unmedicated birth means that you're going to be what they would have an ambulation, which is movement or changing positions, which can really help you move through your birth and also help your baby move through your pelvis and your canal, to be able to navigate that path and that journey for themselves. And you working along with your partner or your providers, and if you have a doula, working through all those things together. I just got back from a wonderful birth where I really feel like this mom was able to help her body unfold, and I helped facilitate different positions, different touch techniques, massage techniques, acupressure techniques, to help with stimulating that journey for baby and those movements that needed to take place for baby to be born. But I really love teaching moms different ways, and no one person is going to have the same journey. Neither will you have the same journey if you have more than one child. But in general, an unmedicated birth can often have less interventions in it. Not always. We can't control outcomes, but preparing yourself for that is part of that journey. And I really love it when couples can do that together, because you really see the confidence that happens when that day happens, that they feel a lot more like they have choices and know what to do, which is a really beautiful thing. All right. So let's talk about avoiding those kind of interventions. So a lot of couples really are worried. Maybe you've never been in a hospital situation. Maybe you've never been what like it's called a patient. And sometimes, you know, delivering in a hospital setting, you may feel a little bit like a patient, but you're not there for an illness. And I think that's really helpful to remember in the back of your mind that you're there, having that as sort of a safety net so that you can, if things, medical intervention needs to happen, you have that right there available to you. In general, when we talk about the interventions, the unfolding of different things that could happen, those things sometimes are unavoidable, but doing a preparation for planning on a natural childbirth may help you to have less interventions or maybe avoid them altogether. Okay, so let's talk about what is an epidural. I think that some people are really fearful of what an epidural is, what it might, having a needle in your back, a lot of that sensations. Some women really don't want to be trapped in a bed or, you know, not be able to move. And an epidural is a medication that is delivered in the spinal space. Okay, it is a local anesthetic that is injected into the epidural space and those spaces that surround the tough protective covering of the spinal cord. It does block nerve signals from sensory and motor nerves, which translates to a fairly effective pain relief, and it does immobilize or limit mobility in the lower body. It doesn't mean that your epidural will make your legs totally numb, but they will feel very heavy. One of the things I tell parents about the epidural is it doesn't cross the blood-brain barrier, so it is an effective tool for parents, and it's often the ones that if your goal is natural childbirth, but you need some support, this is feels like the best step for a lot of parents. And just like this picture of a dad really being there, being present for that mom who didn't plan on having an epidural, but she's getting one. There are ways to make this a really connected time, if that might be the course that needs to happen for you. But I think learning about natural childbirth and an unmedicated birth and how to walk through it, as well as learning about how I can easily get through an epidural with my partner and myself or my doula, so that you feel prepared if that happens for you. All right. So birth doesn't just begin when you start labor. It, in fact, is kind of, there's this whole sort of preparation, right? Every day you're preparing your body. And your preparation for the day of your birth may have started before you got pregnant. So you may have started by changing your diet or including prenatals and folic acid into your diet, so that you could have a more likely to conceive and that your body would have the nutrients it needed to carry a pregnancy. Thinking about looking at where we start. So everybody kind of starts their pregnancy in a different sort of health. You may be 25, you may be 35, you may be 40. So everybody kind of starts at a different thing. But I think a lot of women feel that the pregnancy is a time for them to improve their own health because they know that that will also benefit them and their baby for the birth, and then also helping change our lifestyles and our nutrition so that we can share that better health with our children moving forward. So thinking about preparing there's so many components, but our uterus is our largest muscle in our body, on the female body. And it is so powerful, and really doing the work to help prepare your body to nourish your uterus and your baby is really, we don't really necessarily think about it every day, but it is so, so important. And also preparing our mind for that journey, not only changing and the concerns about being ready for labor and understanding labor, but also being prepared for parenthood and those kind of worries that we have and anxiousness about taking care of the baby. And am I ready for that? And am I going to do a good job? And all of those things that ruminate in our heads. So once you're pregnant and your health and your baby's health become kind of more of your focus, right? That nurturing, it is definitely, undoubtedly, we're going to start paying more attention to what we put in our bodies, because we know that everything that we eat is going to nourish our baby and help our babies grow and thrive. So overall, during this time, your body is growing a baby, shifting all of your organs around to make space for your baby. Your blood volume expands as well. And this helps aid in offering nutrition and oxygenating baby through the placenta. So some of the benefits of improving your nutrition during this time are that your baby will be born at a healthy weight, okay? Like thinking about babies who might be underweight or babies who are kind of large, especially if you're first time mom, that might be a concern for you. Decreasing the likelihood that your baby will have any type of birth defects. Also helping your baby grow a healthy brain, decreasing the risk of your complications as a pregnant woman, reducing your risk of anemia, preeclampsia, and gestational diabetes. Also lessening the prevalence of uncomfortable symptoms, such as morning sickness, constipation, fatigue, and other things. You're also going to lower your odds of preterm labor. No one wants to have a tiny baby who might need extra support, and we can't always control that, but we can definitely do things like putting the right foods in our body. We also can promote a faster postpartum recovery. So all of that great nutrition that you're putting in is going to help that. And also eating right also benefits our mental health. So this can all, happen with just assuring that you have different types of foods. Here at High Country Doulas, myself and Sarah are all both prenatal health coaches. So if you have any interest in learning more about improving your diet, you can always reach out to us for that. We love doing webinars on those kind of things and doing one-on-one for parents. Some of the important things about eating during pregnancy does include thinking about what you need in those different trimesters, knowing that eating for 2 doesn't really mean eating twice as much. It just means being twice as careful about what you eat. Not to say that if you do eat some bad things now and then, it's gonna impact you really negatively. It's really about looking at the whole thing. I always tell parents who have little ones who are starting to eat, and toddlers who eat in this really random patterns, is don't look at that one day that your child ate not like you would have wished they had. Look at the week and look at what they eat in a week. I think that's a good rule of thumb with pregnancy as well. But your first trimester, you really don't have a lot of added caloric intake. Eating protein in the morning can be a great way to help reduce your risk for morning sickness. In the second trimester, you will be upping your caloric gain for approximately 300 to 350 calories a day. And this also depends on your pre-pregnancy weight. So underweight moms are going to be eating more calories. Those of us who have a normal BMI, we're going to be eating this recommendation. If we have a high BMI, then we may not add that many extra calories. And you can talk to your providers about this if you have any concerns. By the time you get to your third trimester, your body will be eating about 500 extra calories per day. So this kind of translates to about 1,800 calories first trimester, 2,200 in the second, and 2,400 in the third. So again, just thinking about focusing on the quality of the food, what you're putting in there, what's the source of that food, and considering it. If you've been pregnant during the summer, it's so much fun to be able to get out there and go to farmers markets and get local food. The more we know where our food comes from, probably it's not as old, it's fresher, and we can really get some great ingredients. So definitely enjoying that. And I think it really benefits parents moving forward, because you are trying new things, and then you're going to incorporate those same diets into your child's diet once they start eating foods other than milk. So thinking about what are the benefits to you and baby. Definitely, when we think about preparing for a natural childbirth, you as a woman will notice that if you are able to achieve natural childbirth, you will feel like you can get straight out of the bed, go to the bathroom, eat. You have less impact because you have less drugs in your system. You may still feel really tired because birth is a marathon. It's a really long process, especially for first-time parents. And so we really want parents to know that that time you're going to feel really tired and exhausted, but you're also going to have those great, hormones flowing, bonding with your baby. And not having had interventions, all of those things will be working optimally. So all of those hormones and flow in, the oxytocin, the bonding time, you'll have a lot of less interruptions with that. Your baby also will not have gotten any ill effects from any types of drugs or things that you had been taken in. And so they're going to be very alert and awake and ready to bond with you. So those are some of the wonderful benefits of being able to achieve natural childbirth. So getting ready. What can we do to get ready for natural childbirth? Kind of thinking about what is important to you in this journey. Thinking about your mental health and how are you feeling, or what are the feelings that you're having? Are you feeling anxious about your birth? Do you feel pretty confident, like you have maybe been around people who have also had natural childbirth and they've been very supportive of that process for you, and you feel really confident in that? So think about where you're at starting in this journey, and then think about what do you need to help you be able to achieve this? What work do you need to put into this? Who do you need to have on your team? And then also just, I think sometimes, usually with pregnancy, you're going to be like working and you're going to be like focused on other things. So sometimes maybe even just taking 5 minutes in the morning to spend, or after dinner to spend time and writing down a few thoughts or a few things that you'd like to do before that big day can sometimes really be helpful. The importance of creating sort of building up your confidence is really surrounding yourself by people that you love and spending time with them. Thinking about being with other people who have experienced and have confidence in natural childbirth. I know for a lot of women, they may have either family members or friends who are like, you don't want to do that, or that's not something that it'd be safe, or, you know, and I'm, as a doula, we do from cesarean birth to epidural birth, and anything in between. And it's a woman's choice in my mind of what she wants to do. So I think, you know, I support whatever goals she has. But if you do have the goal of an unmedicated birth, getting connected with people who have experienced that and see that as normal, really champion you and cheerlead you, are going to be really important, so that you can mentally feel more confident about what you're doing. And hearing stories of people who've had natural childbirths and how that have gone can be really helpful. Sometimes it's not so helpful to read those ones about the bad bad outcomes with, or somebody who wanted to have natural childbirth and ended up with cesarean. Like I said before, you can't completely control outcomes, but you can influence outcomes. So that influence is preparing, having an understanding of the ways that you can help support the process, and getting those people who love you and who are your, I guess, going to be your cheerleaders, whether those is your partner, your doula, your providers, and the nurses in the hospital, all of those people. It's really important, I think, to learn about your options, right? So learning what is available in your hospital. As we teach lots of classes for childbirth education, we know what every facility has as far as your options, how they support you, and what tools they have available in those facilities. Also understanding what are your options as far as comfort measures and techniques if you want to have an unmedicated childbirth. So learning those things by reading books, going to classes, listening to podcasts, and really just knowing what's there. And if you're really passionate about wanting to have an unmedicated birth, definitely look and read stories about women who've had natural childbirth. Watch YouTube videos, listen to podcasts, read books about it, so that you can sort of immerse yourself in the understanding of, wow, this is, so many people have done this. How did they do it? What were their ways that they found success in this? So prenatally, we are just passionate about learning about our babies and getting ready for our baby. And one of the ways we do that is to educate ourselves, read about birth, read about the postpartum, and just help ourselves make that transition to thinking of ourselves as a parent and a mother. It's really one of those things that I think that identity is a big factor here when it goes into, especially having your first baby, right? Thinking of who you are. You may have been planning for a pregnancy for many years, or maybe you didn't really plan this pregnancy, but you're excited about it now. All of that work that you're doing can really help you to shift your thinking and shift your understanding of what your experience is going to be like. I recommend looking at all different sources of information. There's tons of wonderful, we have a blog post on positive birth videos on our blog post. Definitely connecting with High Country doulas or another source for childbirth education can be so, so helpful. And talking to other women who have had natural childbirths, getting on social media groups can be sometimes helpful, sometimes not. So one of the most important aspects that I feel that we do at High Country Doulas is to educate people. We have many couples who we support through the process of labor and birth, but we have many more who just take our classes and help themselves by preparing for their journey into parenthood. And it's a really beautiful thing to be able to do this together, to learn together, to have conversations, and to have a specific time that you set aside to do, to spend on preparing. Lots of virtual classes and in-person classes. If you take classes with High Country doulas, we do work in the facilities in the Tri-Cities and in Western North Carolina and a little bit into Virginia. So we are aware of all of those birthing facilities and what their policies are. So we really like to be able to give you those insights. And some of the hospital facilities do have virtual tours right now and others do not. So I think that's the one great thing that can benefit you, is to have those insights. We also help parents by offering one-on-one chats with them to work on their birth plan. If you've taken our class, you can do that. So it's another great insight and benefit of those classes. All right, so partners. I love helping partners be that 50-50 experience when it comes to birth. And even those partners who are not so sure that they want to be right in there, and they maybe like want to go stand in the corner. So I definitely respect their preferences, but I think it's a beautiful thing to be able to give that other parent who is not experiencing the physical aspects of birth the experience of that transition to parenthood. And it's so empowering, and it's so confidence building for a partner to be fully a part of that experience. And so we think about what can we do to help guide our partners, whether we're that birthing parent or we are the partner. How can we help the women who are giving birth, as well as how as women we can help our partners. Sometimes we get calls from women who are like, I need somebody for my husband. And we're all like, okay, we love helping support parent, that anxious parent who is really not sure about being in a hospital at all, right? Or that what's going to happen, and needles and all of that. We may have that parent who's just like, I want my partner to be supported, and I am not really sure about being a part of this, except I want to hold her hand at the end. So there's all ranges of those really engaged partners to like, I need support. And really, especially for those anxious partners, we do a lot of support for whatever goals you have. And if a woman feels totally confident and is, I don't really need that so much support, but I want you to make sure that he's okay. So that he can be there when it's the important parts, I want him there. So lots of different reasons, but there's lots of great books out there for partners. And I really think I've gotten feedback from partners. I had a mom the other day who told me, she's like, my husband was just so amazed by this class. They were taking the Comfort Measures boot camp. He just said, he was like, I didn't know it was going to be like that. I didn't know I was going to learn so much. And he said, I really walked away feeling like I had learned some actual practical things that I can do. He said, I thought I was just going to learn about what's going to happen to you. And he was really excited. And he was like, oh, he was going on and on. And so she was like, I really wanted to share this with you. But I think we can't leave partners out of this. And sometimes they take a little bit of encouragement. But if you have any specific questions, I've got a couple of books that I love to give to partners, so we can share those at the end if you want to. All right. I think that whatever level of activity that you are before you get pregnant, you should just keep that going. And if you're not somebody who moves a lot, maybe consider starting slow and gentle, just strolling, taking short walks, maybe floating in the pool a little bit and moving around. But definitely, from my personal experience as a birthing person and from my experience with other women, movement is a really big factor in keeping our muscles strong, keeping our mental health strong as we shift into those later weeks of pregnancy, and allowing ourselves to have the strength and maintain a strength to be able to push through the labor. Labor is a lot of work, and I think being prepared for that physically can benefit you. I did have a mom one time who she couldn't find like a prenatal yoga class, so she just took like gentle yoga. And she said to me after the birth, she goes, I really think that is how I got through this birth. You know, like that was her tool that helped her to be prepared. She was just really good about staying with going to yoga. So it's wonderful there's lots of different options for you. So prenatally, exercise can be super, super important. And you always want to check with your provider, knowing what your health status is. But there's lots of options out there. There's videos that you can do. There's online apps that you can do. You can have private classes. You can try to take in-person classes, but probably those are kind of harder at this moment. But exercising about 30 minutes a day, or just exercising 20 minutes 3 to 4 days a week, can still be super beneficial. And it's also a great time for you just to connect with your body. I think that birth is a very physical thing too, and preparing means spending time moving and connecting with your body. There's lots of resources we can send you that you can look at online. If you're interested in that, we'll provide you with some links after this webinar so that you guys can find out more. It is really important to know your limits, checking on yourself as you move through pregnancy. I do often tell moms that you're going to start to feel like a little pokier, a little more awkward with your body, in your body, as your weight distribution changes in later pregnancy. So making sure that you're monitoring your heart rate, making sure that you're well hydrated. Often women will start to have shortness of breath in late pregnancy as the baby grows higher into the abdomen and pushes on all of those upper organs, and just so many things that can impact it. So sometimes, you know, if you are an advocate of like CrossFits per se, you may be able to continue to do some of those things up until, but you may have to slow down, and modifications are a great way for you to still be able to move and do those things. But you definitely want to check in. And if you have any questions, definitely always check in at your prenatals with your provider if you're noticing any issues. Definitely the stresses on the weight of baby can put a lot of pressure on our ligaments and back. But we do know that exercise will reduce things like back pain. It will reduce things like insomnia in late pregnancy. So continuing to move is important. It's just finding those limitations and really listening to your body, which can be, you do not want to do things like exercises that may cause abdominal trauma, extensive jumping, bouncing while stretching is not super good, waist twisting, maybe pulling or stretching on some of those overly taut already. Exercise in hot environments. We can really just like not getting in hot tubs, but we don't want to overheat ourselves. And because we do have relaxin, which is that hormone that starts to help loosen our joints for birth, we can be a little bit off balance. So it's really important, not only during exercise, but just even going down the stairs, hold the handrail. Never want to put you at risk for like a sprained ankle. Nobody wants that in pregnancy for sure. Okay. So among things like yoga, right? A lot of the different ways that you can prepare is to kind of connect with your birth. And for myself personally, what I've learned being a doula for many years is that we don't all breathe or have a connection with our breath. If you've done yoga or been in a yoga practice, you may. If you've been in some type of athlete, where like a runner, where you really had to manage your breathing, you may have spent some time playing around with breath. But for a lot of us, we may not have ever done that. And breath can be a really useful tool, not only as aiding in your oxygenation during pregnancy. Remember, you're supplying oxygen to your baby through their umbilical cord. So when we have shallow breath, we're not really getting good oxygen flow. So learning how to take a deep breath. Some women can do this during pregnancy. There's definitely different apps out there that can help teach you different breathing exercises. We teach different breathing exercises at our Comfort Measures bootcamp. And just learning to take and intake a long, slow, deep breath is a really wonderful tool for you to prepare for your active and pushing stages of labor. It can also be really helpful just for our stresses too, and reducing our stresses. A lot of women who may have a little bit of high blood pressure, it's a really good for that. All right. So it's a matter of preference of how you really want to connect with breathing, right, in your life, but you may be a person who is gravitated towards meditation. Meditation is a time spent either guided or with someone guiding you, or self-guided. And we'll send you some resource links if this is something that you might feel would connect you during your labor process, or maybe just even during pregnancy, to help you kind of feel more balanced with your body and your mental health. You may have already gotten a prenatal massage, or you may have already been utilizing chiropractic care or any other types of Bodyworks. A lot of women can really have a less stressful pregnancy and have less pregnancy concerns, such as low back pain, sciatica, those things, by frequenting to get that support of Bodywork. Whether it is like getting a prenatal massage. If you already have a massage therapist, sometimes people will stay with their massage therapist, but there are specific people who are trained to massage pregnant people. So something to note. Some of the benefits of things like massage can be increase oxytocin. As a doula, I am like, one of my big goals is to hold space for oxytocin. Massage therapists do this really well. They will increase that oxytocin. In late pregnancy, in our bodies, our oxytocin receptors start to open up and be ready for labor to start. Getting prenatal massages in late labor can benefit you to help get your body ready for birth. It can also help reduce anxiety and depression, relief from joint and muscle pain, hormone regulation, cardiovascular health. If you have swelling, which a lot of women do, it can help reduce that and improve your circulation, nerve pain, and also sleep. So if you have any questions or want reference for somebody in your area who does prenatal massage or chiropractic care, anything like that, definitely send us an email. We'd love to share that with you. So thinking about what you've done so far, what have you found helpful? What has been your kind of connector to get you interested in having a natural childbirth? What has really excited you about becoming a mother? Or what have you, what tools have you used thus far to kind of get yourself on the path to readiness for your birth? So thinking about those things, it's just really neat to think about that that process, and really just give yourself grace, because if you haven't had a chance to spend a lot of time on this, there's still time. And as parents, we're lifelong learners, right? We never stop learning and growing. So just remember that. All right. So besides all of the other things that we've talked about, really wanting to have the right people there with you. You've already kind of, maybe you've already decided who's going to be your provider and where you're going to deliver your baby, and where you're going to, you know, how that's going to go. Maybe you've already even created your birth plan. These things are really important pieces on the journey to a successful natural childbirth. Knowing that those people know and understand what your goals are, you've built trust with them, you've felt heard, you feel comfortable, you feel like you can be yourself, you can kind of let go. Because one of the important pieces of being able to have an unmedicated birth is to feel at ease. That's going to improve your ability for your oxytocin to flow in your body. And remember, oxytocin, I'm that keeper as a doula for it. So what does it do? It contracts our uterus. And to be able to have a baby, we have to have some really great, wonderful, long contraction patterns, and really strong. So when you feel safe, your body's going to be performing optimally. So think about that. Think about what you have done and what you can do to help increase your odds of having that unmedicated natural childbirth. I think this is so, so important. Believe in yourself. One of the things that I did as a pregnant mom was really just to look at like history. I thought about my grandmothers. I thought about like what was their experience when they had their babies. And kind of like entrusted, I surrounded myself with other people who had experienced natural childbirth or understood what that looked like, and just spent time. And, you know, we as women, we may not all have the same journeys. We may not have, some of us might be high risk, some of us might be low risk. If we are high risk, it may be a little bit harder for us to be able to have a natural childbirth than it will be if we're low risk. But you can also change your outcomes by just improving so many things that you have control of, right? You have control of so many things. So believe in yourself, number one, and find strength in your body and the team that you've built. Know that you have done the work to have the best experience for yourself and for your family. I just have this up here because we want everybody to have access. We support all people who are pregnant, and regardless of race, color, sex, sexual orientation, preference, and many other things. Thank you guys so much for joining us here today. We are a resource for you, and feel very comfortable connecting with us, calling us, texting us, or emailing us, sending us messages on Facebook or Instagram. We are happy to respond and would love to provide resources for you guys. Here's how you can get in touch with us. This is our email address, our website, and our office number. Thanks so much for joining us for today's webinar. You will receive a recorded copy of this webinar and some resources attached with that. So thanks so much for being here, and I'm going to stop recording.
Thanks, Allison.
Yeah.